Hello, I'm Matti Aapro. I'm the president of the European Cancer Organization. Thank you very much for the invitation to this very important meeting, where one of the topics is the measurement of outcomes in various areas of oncology. I will be going through several points. The first one I would like to share with you is that you have already heard presentations that look at various perspectives. And obviously, if you take the healthcare provider perspective, the payer perspective, and the patient perspective, which will be discussed later, they are quite different. I will be discussing with you the fact that depending on how we treat the patient, the outcome measurement has to be completely different. I'll give you an example of an outcome measurement that has been proposed by the European Society of Medical Oncology for drugs. Discuss with you that the ultimate real-world evidence of the population perspective is, in my view, not correct. That there are many tools nowadays available where we have excellent nursing intervention that makes a difference for patient survival and patient quality of life. And I will conclude by the European Cancer Organization essential requirements for quality cancer care and the European Code of Cancer Practice, which we should be launching in September of this year. If we look from the surgical perspective, radiation oncology perspective, the medical oncology perspective, of course, always with supportive care, we have to use different tools because the interventions are different and the outcomes are different. So we cannot have a universal outcome measurement for the specific areas, but of course, the final outcome, which is improving the patient's quality of life and if possible, patient survival is very important. Here's an example which is in the medical oncology field. We know that in order for a drug to be admitted for use, you have to go through an EMA recognition. This, however, is not enough. It just indicates to us that the drug is safe and has, within the terms of the registration authority, some activity. But we really have to evaluate what is the impact of the drug on the patient and what is the real clinical benefit. The European Society of Medical Oncology has developed this area in solid tumors, and just recently they have published an initial evaluation in the setting of hematological malignancies, showing that the same tool can be, when adapted correctly, also used for evaluation of drugs in hematological malignancies. So this is a very important message. It's not because a drug is registered that the drug is really giving a real clinical benefit for the patient. In cancer, which is nowadays, thanks to many developments, becoming a chronic disease, we should not only be measuring in terms of survival. We really have to take into account the quality of life of the patients. We have to take into account whether the interventions, whichever they are, will shorten the patient's hospital stay or if they will avoid hospitalizations. And this is crucial for the patients and for the healthcare system. The example that I'm giving here to you is one of many. This is the latest one, just shown a couple of weeks ago at the American Society of Clinical Oncology ASCO meeting by colleagues from the Institut Gustave Roussy in France, Olivier Mir and colleagues, showing how, compared to standard of care in this excellent center, the presence of a nurse navigator using also dedicated website and mobile application made a difference. This made a difference in the toxicities reported by the patients. This made a difference in the need for hospitalization and the duration of hospitalizations when patient needed the hospitalizations. So this is another way of making an intervention and of thinking differently from what we have been doing in the classic way until recently. So let me come now to the essential requirements for quality cancer care, which is a work that the European Cancer Organization has been developing over the past few years. It is now part of what we call the focus topic networks. We have 8 focus topic networks in which we have interventions by, of course, our member societies, by the patient advocates, as we have now 20 patient organizations with the European Cancer Organization, and of course, depending by other EU or WHO stakeholders, by what we call Community 365, which includes also drug industry and other specific invited stakeholders when needed. So we have health systems and treatment optimization networks, we have digital health, we have prevention, and as highlighted here by the arrow, the quality cancer care network. We also have the survivorship and quality of life network, an inequalities network, a workforce network, and the HPV network. But let's concentrate on the quality cancer care. So what we are trying to look at is what are the data available in order to tell all colleagues in Europe, all stakeholders, on what is the best way to go forward. We also discuss the metrics, i.e. Here we could call these the outcomes, and then the codes of practice and the communication about this, and the accreditation programs for cancer centers and networks in collaboration, among others, with the European Cancer Institute Organization, OECI. We have published until now several of these. A very important one, taking into account the importance of primary care. Then some developed around soft tissue sarcoma in adults and bone sarcoma, colorectal cancer, esophageal and gastric cancer, melanoma, just recently on prostate and on breast cancer. The last one be launched on June 25th, and of course inviting you all to the launch event, which will be as all events are nowadays through the communications on the website. The other point that we just decided at the General Assembly of June 5th was to launch the European Code of Cancer Practice. You are certainly aware of the European Cancer Patients' Bill of Rights, which was launched quite a few years ago. Seminal work that was done by many colleagues who also participated in the development of the European Code of Cancer Practice, which was co-created by the healthcare professionals of the European Cancer Organization and by our patient groups. All of the points that we'll be making, which will be 10 points, will be based on the evidence available and will be backed up by specific papers and translated, if only possible, in all languages used in the European community. One example is here, which deals with the importance of multidisciplinary care, and this very simple wording that's very important for the patients. You have a right to receive care from a specialized multidisciplinary team, ideally as part of a cancer care network. Well, thank you very much for asking me to be present and making an intervention in this important meeting.